Myelodysplastic Syndrome. Myelodysplastic Syndrome, MDS, is a group of clonal hematopoietic stem cell neoplasms characterized by ineffective hematopoiesis. This results in cytopenias affecting one or more blood cell lines, red cells, white cells, and platelets. Bone marrow is typically hypercellular but produces dysplastic and functionally impaired cells. Myelodysplastic syndrome is a heterogeneous condition with variable prognosis and in some cases progresses to acute myeloid leukemia, AML. Peak incidence. Primary myelodysplastic syndrome, the majority of cases. This is more common in older adults, typically diagnosed over the age of 60. It is often due to spontaneous somatic mutations. Secondary myelodysplastic syndrome. This occurs after exposure to chemotherapy, radiotherapy, or environmental toxins, for example tobacco smoke and benzene. It usually has a worse prognosis. Pathophysiology. Mutations in hematopoietic stem cells disrupt normal differentiation. This leads to dysplastic changes in red blood cells, white blood cells, and platelets. Bone marrow is hypercellular but produces non-functional cells. A blast count less than 20% confirms myelodysplastic syndrome, and over or equal to 20% indicates transformation to AML, acute myeloid leukemia. Cytogenetic abnormalities, for example del5q, monosomy 7, and trisomy 8, all influence disease subtype and prognosis. Symptoms. Some patients are asymptomatic at diagnosis, and others present with symptoms from cytopenias. Anemia, fatigue, pallor, weakness, and dyspnea on exertion. Leukopenia or neutropenia, recurrent or severe infections. Thrombocytopenia, bruising, petechiae, and mucosal bleeding. Constitutional features, for example fever and night sweats, which may suggest progression to acute myeloid leukemia. Signs. Pallor, petechiae or ecchymoses, splenomegaly or hepatomegaly, which may suggest transformation to AML, and lymphadenopathy is typically absent. Diagnosis. Full blood count. This shows cytopenias, anemia, neutropenia, thrombocytopenia. Peripheral smear. Dysplastic red cells, anisopoikilocytosis, abnormal neutrophils, hypogranular, hypolobulated, and giant platelets. Bone marrow biopsy. This shows hypercellular marrow with dysplastic hematopoietic cells. Blast count is less than 20%, and ring sideroblasts may be seen in certain subtypes. Genetic testing. Cytogenetic and molecular studies to detect chromosomal defects. Risk stratification. Revised International Prognostic Scoring System (IPSSR) incorporates cytogenetics, cytopenias, and blast count. Complications. Transformation to acute myeloid leukemia. Severe anemia, bleeding, or infections due to cytopenias. Iron overload from repeated blood transfusions. And death from sepsis or hemorrhage. Management. Management depends on the disease subtype, patient comorbidities, and prognostic score. All patients should be referred to hematology. Supportive care. Red cell transfusions plus or minus erythropoiesis stimulating agents, ESAs, for the anemia. Platelet transfusions for bleeding or very low counts. Granulocyte colony stimulating factor, GCSF, for neutropenia. Disease modifying therapy. hypomethylating agents, azacitidine and dakitabine. Immunomodulators, lenalidomide, particularly effective in del(5q) syndrome. Immunosuppressants in select cases. Definitive therapy. Allogenic hematopoietic stem cell transplantation. This is the curative option considered in younger or fit patients. Monitoring. Regular full blood counts, clinical reviews for disease progression, and repeat bone marrow biopsy if transformation is suspected. Iron chelation therapy may be required in patients with transfusion-related iron overload. Prognosis. Prognosis is highly variable and depends on IPSSR classification. Low-risk disease may be stable for years with supportive care. High-risk disease has a higher chance of transformation to AML and shorter survival. Secondary myelodysplastic syndrome carries a poorer prognosis compared to primary myelodysplastic syndrome. That was the full video, and there's hundreds more like it waiting for you at finalmed.co.uk. Get over 9,000 UKMLA exam questions, hundreds of animated videos, and our trusted textbook all in one platform designed to make your revision faster, clearer, and exam focused. Start your free 7-day trial today